Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Derr, and I will be your host for today's episode. Hi, welcome back to our podcast today. I again have Jessica Scruton here. She is our Clinical Transformation Advisor at Lightbeam, and today we're going to talk a little bit about healthy living and 5 kind of tips and steps you can take to live a healthier lifestyle. So, Jessica, how are you doing today?
Good. How are you?
Good. Did you have a happy New Year?
Yeah, no, I had a good New Year's. There were a lot of parties, lots of overindulging in lots of different things, but it was fun for sure. Yeah. Same for you?
No, I decided to stay in, just ordered food in, and watched the ball drop and had a very low-key New Year's. I liked it because usually I have plans, but just wanted to be calm,
Well, no, that's a good idea, and I think the reason that people celebrate such a huge night on New Year's Eve is because what's January 1st? The day that everybody starts their resolutions, right?
Yeah.
So that's a good segue into what we're going to talk about today with the healthy living and healthy lifestyles. So last time when we did a podcast, we talked about the seasonal depression and how to really take care of yourself mentally. And today we're going to talk about not just the mental part, but how to take care of yourself physically. So like I said, everybody has all these resolutions on January 1st. We're going to kickstart the new year with a new lifestyle, and there's all sorts of different things that people are trying to accomplish in a short time frame. I thought a lot about this when we were talking about the topic. I talked to friends that are big in healthy living, healthy eating, exercise to see if they had tips and tricks. There's 5 areas that we're going to focus on. So there's diet, nutrition, there's physical activity, there's alcohol and tobacco use. The 4th one is sleep schedules, which is a lot bigger than most people think it is. And then we're going to talk about personal social relationships. So when I was thinking about these 5 topics and how to talk about them in a way that made the conversation relevant as well as new, I started to think it wasn't really that people don't have the information on what to do. They know that they need to eat healthy. They know that they should exercise. They know that they shouldn't, drink and smoke, or if they are going to drink in moderation. But my big thing was, how do you walk into a healthy lifestyle and make these choices and have them stick? Do you know what I mean?
Yeah, and I think living a healthy lifestyle can be very daunting because it seems like there's so many different parts, but we can take little steps to get closer and closer and start those positive habits to living a healthy lifestyle.
Yeah, that's a really good way to say it, though, because like if you think of it as, you're looking up Mount Everest or something, you're like, there's no way I'm ever going to get to the top of that mountain. I think setting these obtainable goals for yourself, or what did you call them when we talked earlier? Mini goals?
Micro resolutions.
Micro resolutions.
Yeah.
It's a lot easier to stick to that kind of thing. So as we talk about these 5 areas, I think we really need to focus on not just what you can do to live a healthy lifestyle, but how you can get there.
Yeah.
Okay, so before we get into what the actual 5 areas are, I think it's important, because we are in healthcare, to level set with, you need to make sure that anything that you do decide to implement, whether it's exercise, diet, that you have the okay from your physician. So if there's anybody that's listening to this that has conditions or is looking to lose, a significant amount of weight, or has medications that they take, obviously you want to get everything that you do cleared through your doctor. Their goals for you might be different than what yours are for yourself, so it's important to kind of align those goals as far as the healthy living and what that looks like. The first area that we're going to focus on today when we're talking about the healthy living is diet, nutrition. Oh man.
This is a struggle. This is a struggle for me on a daily basis.
It is. It really is. And there's so many diets out there right now that it's like, oh, are you going to do keto or paleo or intermittent fasting or Whole30? There's so many diets out there, and how do you identify where to start? And I will tell you, everything that I just listed, I've tried them all. And the biggest downfall is that it's hard to maintain.
Yeah.
So, when you're looking at healthy eating, it's not just about making sure that you're getting all of the protein in your diet that you need, which we all do, drinking plenty of water. These are tips that everybody knows, but how do you implement that into your daily activities to make it stick. With the micro resolutions that you talked about, I thought that was a really good way to say that.
Yeah. I think one way, especially when it comes to drinking water, like you mentioned, a really easy thing to do is adding an extra 16 ounces of water into your day until you get to the point where you're drinking the recommended amount of water each day.
That's easy. That's easy to do. I mean, 16 ounces is not that much.
Or replace your
Diet
afternoon
Coke.
soda. Yes. Or just, thinking about a way to replace a drink that you currently have, whether it be your morning energy drink, replacing it with something that's a little bit better, a coffee or a tea, and then incorporating more water into your diet.
Those are good tips. My big thing is vegetables.
Mm-hmm.
We all know we need vegetables, and we all know that most of us don't get enough vegetables. To plan meals around having that involved in every meal, to me, the word you used earlier is daunting. So I made a deal with myself that I was going to have one more meal a day that had vegetables in that. And that's a small change that was easy to make. And it's so far I've been able to stick with it. So it's very easy to just say, okay, I know I have to eat vegetables all day, every day, but instead I'm just going to do it for one extra meal a day. And the big thing for me, I don't know how you feel about this, is when you work in an office, we have food all the time.
Yeah.
And if we don't have food and I don't bring a lunch, then we, order something in, or we'll walk to get lunch. So again, I made a deal with myself that one less meal a week, I was going to bring into the office. So I'm going to pack a meal a week, and that's a small goal that I can stick with. And hopefully, just like you were saying with the water, it'll start to increase.
Yeah. I think that's a great step. Because it's always harder when you're surrounded by free food in the office.
No, I know, right? I had a nutritionist that I worked with in the past that used to run a obesity program for underprivileged. And I remember having a conversation with him where he was talking about the fact that frozen meals, they might be processed, but one frozen meal a day or a couple times a week is not the worst thing you can do for yourself when you look at where you were before. And a good meal, a balanced meal, he would say, would be get a frozen meal with the protein, get a bag of frozen veggies, cook them, and you've got a huge amount of food to eat that's healthy because you've got all the vegetables that you're filling up on. And so having one frozen meal, is not as negative as people might want to think it is. I mean, if we could all eat natural, unprocessed food all day long, that would be great, but don't feel like you're not doing the best thing for your body if you are eating frozen meals. Just supplement it with vegetables as well.
Yeah, I think that's great. And especially now, there's a lot more healthy frozen options. I feel like every time I go to the grocery store, there's a new company that has an even better version of what was already out there.
For sure. No, I agree with that. And it's, as you said, it's evolving. And so people have this thought in their head that frozen meals are not always healthy, but that's not necessarily the case. We do want to, when we're looking at the tips for healthy eating, we do want to stay away from processed foods as much as possible. You mentioned drinking water. Protein is a very, very important part of our diet. Eggs are extremely, extremely full of nutrients, and I know at one point we all thought that they were also full of cholesterol, but that's not necessarily the case. There's a lot of good sources of healthy fats. And I think that most of us know that. I think most of us know that you should, maybe use extra virgin olive oil instead of butter for cooking. But again, what the focus here would be is to set goals for yourself that you can maintain. The biggest thing is going all in. If I don't follow it all the way, then I feel like I've not been successful, and so then I'll just quit. And that's not what you can maintain a new lifestyle, especially with the eating pieces.
That's where I think the micro resolutions really help, is setting the small goals so you don't get burnt out so easily. Because when you start January 1st wanting to hit the ground running and change everything about your current lifestyle, there's barely a chance that it's actually going to stick.
Yeah. So diet nutrition, I think the biggest, we've had some key points there on how to maintain and what you can do to set those resolutions or micro resolutions. So the next big thing is physical activity. I know you work out a lot.
I wouldn't say a lot, but I'd say
you
a decent
work out
amount. Yes,
more than most people. I think that's fair,
yeah.
right?
I try to get in about 3 or 4 times a week.
So how did you take that from before you worked out to where you're at now to making it just part of your lifestyle? Like brushing your teeth in the morning, you know that you're going to do that every day. How do you make that shift?
I think you kind of have to start out slowly. Maybe give yourself the goal of working out twice a week, and not necessarily, it doesn't have to be getting to the gym twice a week. It can be going on a really long walk for one of them and then going to the gym, or going to a workout class with a friend. Also just doing stuff outside. I think it's kind of taking the step to being more active, being less sedentary. And I kind of worked my way up to realizing that when I worked out, I felt better about myself. I was in a better mood afterwards. Even though the during process isn't always that fun, I did feel a lot better afterwards. So I think to get to the point where I am, usually about 4 times a week, it definitely took some building to get there.
It's definitely more than average, I would say. The recommendation, after you get the approval from your physician, is 30 minutes a day, right? That's something that is probably pretty feasible for an average person. When you're thinking of people, or if you have this idea in your head that you're so far out of shape that 30 minutes seems impossible, or you know that you have a significant amount of weight to lose to get back into that normal BMI, 30 minutes, again, the word I keep thinking of when I think of these goals and resolutions is daunting. So the tip too with this would be, don't set yourself up for failure by saying you're going to do 30 minutes a day every day. Start with your tips where you said get outside more,
Yeah, one thing I like to do just almost every other day in the office is go outside during a break time and get a walk in. I usually try to go for like half a mile, which is at a leisurely pace, about 10 minutes. And that's just an easy way to get some fresh air and get some steps in.
Yeah, and you probably come back feeling pretty refreshed.
Yeah, especially I love after like you've been in a lot of meetings and you've just felt very cooped up. It's kind of nice to be able to take your mind off that.
And it's super healthy to do that. So those are great tips. You mentioned exercising with friends. Accountability is huge. I know that when I am setting exercise goals that there's no way I'm going to be able to maintain that without saying, hey, Laurel, you meet me at the gym at 4:00 today, because then I don't want to let you down.
Yeah.
So
yeah, a lot of people need accountability partners, and I love to invite my friends and make sure that we're holding each other accountable.
Yeah, it's so important. Something I thought was really cool was one of our coworkers is big into exercise, and I realized from talking to him and seeing what they're doing is they've incorporated it into their family lifestyle. Our coworker, his wife, and their child are all going together to exercise, and I think that's super important as well. Not just friends, but like that's a family connection, and it's something they do together as a family. So you're building the family unit, but you're also staying healthy. So on top of just working out with your friends, that's huge. But, the whole walking with coworkers at lunch, that's great. And even if it was to walk to lunch to go get something, you're already setting yourself up to be in a better position because you're not sitting at your desk ordering food in. The third one, alcohol and tobacco use. There's really not much to say about this. Tobacco is bad for you. It is not part of a healthy lifestyle. Vaping is bad for you. Chewing tobacco, dip, it's all bad for you. We all know this. But it's a matter of how do you move from saying, I know I shouldn't do this, to a position where you're able to do it. And alcohol too, alcohol in moderation, it can be difficult when you're in alcohol in moderation. It can be difficult, especially if you're in a position where there's lots of, out to eat, lots of parties over the holidays like we talked about.
Yeah.
It's difficult to be able to do that. But if you just remember that if you do better today than you did yesterday, then you're making a difference with your health. So saying I'm going to quit smoking today, if you smoke a pack a day, probably a very difficult task to do it. There's so many medications out there now that can help with it, that make the whole process a lot easier. Support systems, And it really is the number one best thing you can do for your health. Having resources available to you, understanding what you can do as far as taking medications prescribed by your physician. But even if you are a person who has tobacco after they have lunch, maybe instead go for a walk with your coworkers. One time a day that you're starting to swap out these bad habits for healthy ones, they're all going to add up.
So I have a question. Does nicotine raise your endorphins, or what is the response that nicotine provokes?
Yeah, I know why you're asking that too. Because I just mentioned about going for a walk with your coworkers after lunch, if that's usually when you could have a cigarette. So yes, nicotine has the same response on your neurotransmitters, your endorphins, that a brisk walk would have. It increases the endorphin, so it makes you feel good, satisfied. Now, if you tell somebody that's been a long-term smoker, go for a walk, you'll feel just as good. Probably not going to buy into it right away, but definitely is giving them that same feeling in their brain where they have the endorphins. It's one of those things that we all know that it's bad, but having the resources to quit is vital, and it is, again, the best thing that you can do for your health is to not smoke. Same with the vapes, especially with all those stories coming out now about the vapes.
Yeah, it's really scary.
Yeah. And alcohol, I mean, consumed in moderation, that's 1 drink per day for women, 2 for men, 1 glass of wine, 1 beer, 1 liquor, 2 for men. And there's a few things that can cause that to kind of vary. I mean, or 1 drink a day for women, 2 drinks a day for men are fine as long as you have a normal functioning liver. You don't have any other mitigating risk factors. But if it's the same with the tobacco. If you can't keep it in moderation, or if you feel that there's a struggle, or if you ever question if you're able to control it, that's a sign that it might be, time to speak to your doctor, family, whoever you can as far as resources go to help you figure out a path forward for that process. It's a slippery slope, and keeping that healthy living and healthy lifestyles, everything in moderation. But if you can't do it in moderation, it is a disease just like diabetes, and there's help out there for that as well. So we've talked about nutrition, we've talked about exercise, we've talked about smoking and alcohol. The 4th step to healthy living is sleep schedules. I can't tell you how much I didn't realize this was important until I got older. I remember being in college and sleeping 4 hours a night for a week, and just being able to maintain my studies and my friends and all of that. But there's so many reasons that it's important to have a regular sleep schedule and get enough sleep. We just talked about this in December.
I think and especially since December and since the holiday break, I've been struggling with keeping my sleep schedule consistent.
For sure. And there's so much that plays into our sleep that we're just not even aware of on the surface. It's hormone imbalances, cortisol levels, insulin. It's driven by what we eat. We talked about the melatonin with our last podcast, and once you get into a cycle of sleeping in, it's hard to get up and not feel groggy in the morning. But I think that the amount of sleep that you get, the regular sleep, helps you maintain the other pieces as well. I don't know about you, but if I'm exhausted, I feel foggy. I don't feel like I make good choices. I'm much more apt to not exercise. I'm much more apt to drink a Diet Coke instead of a water, because I feel like I need that caffeine. So all of those things are, it happens to all of us, but do your best to try and get a regular amount of sleep.
Yeah, I definitely feel what you're saying. So like last week, for example, I was really tired, and every day I went to bed and I told myself I'm going to make lunch for myself in the morning, and I got up and I was just too tired. So I ended up buying lunch most of the days, which I shouldn't have. But now, hopefully, that I'm getting back on a normal schedule, I will go back into my routine and be able to get up, make my lunch, and head off to work.
Yeah, and it's like a cascading effect. You're tired, you wake up, you don't make your lunch, you drink more caffeine, you don't go for that walk. So it's I wouldn't say that it's the most important, but I do honestly believe that the amount of sleep you get plays such a big role in the other areas that if you can maintain anything, it would be the sleep. Mm-hmm. And the other thing I would say about that, again, being in healthcare, is sleep disturbances, having difficulty falling asleep, staying asleep. These are all things that you should talk to your doctor about because there could be an underlying condition causing it. Yeah. Cortisol levels are huge when it comes to being able to maintain a healthy sleep pattern, and that's not something you will ever know without going to your doctor and having it tested. Mm-hmm. So sleep, important. The last piece, and I think that this is very, very underrated. That's a good word for it.
I think it's also easier said than done. It's an item
That's fair. The last one we're talking about, number 5, are personal and social relationships. Mm-hmm. So many reasons that this is important. Mm-hmm. I have a hard time saying no to people too.
Yeah, I mean, you always want to help everybody and you want to do everything.
And that is not healthy. It's not healthy to be accommodating to everybody else and missing parts of it for yourself, for sure. Maintaining healthy personal and social relationships means taking care of yourself by allowing yourself to say no to mm-hmm. requests that will cause you to not get your healthy sleep patterns and healthy eating. Actively managing relationships and making time for friends and family that make you feel good mm-hmm. is important. The example I can think of, that we have a group of friends that we get together on a regular basis. Our kids are best friends and we're best friends and we see a lot of them, and we make a very conscious effort to schedule time to be together because it makes us feel better, feeds mm-hmm. my soul, if that makes sense. Mm-hmm. So making time for that relationship and family and seeing our family on a regular basis and having them be around is super important. So it's important to keep time for relationships that make you feel good, but also be able to say no when there's something that you feel will be of detriment to your health.
Have you heard of the blue zones before?
No. Mm-mm.
So they found, after a lot of research, that there are certain cities in the world that people are living a lot longer than other places.
Really?
And they've been studying kind of what they're doing, what they're eating. And one thing that kind of ties all of these places together is their lifestyle and how they are surrounding themselves with their family and their friends and living at a slower pace and enjoying the time that they have with others.
I love that.
It's really interesting, yeah.
I love that. What's it called?
The blue zones.
Okay. I'll have to look at that.
Yeah.
I think it's interesting because I think that there's a lot of research behind the other 4 areas that we talked about and why they're important to your health. Mm-hmm. But, maintaining healthy relationships is something that doesn't get enough screen time or air time, and it's definitely important to your overall health. So really, those are the 5 things for healthy living. Mm-hmm. If there were any major takeaways from this conversation, I think, in my opinion, it would be setting goals that you can stick with. What'd you call them again?
Micro resolutions.
And understanding that nobody is perfect, and knowing that you should do something and actually executing on it are 2 different things, but that doesn't mean that you give up. You have to start over the next day and do everything you can to continue to feed yourself in a way that makes your body happy, healthy. Mm-hmm.
Thank you, Jessica, so much. I really enjoyed talking with you about all of these 5 areas that we can each make small improvements in.
Yeah, thank you. You had a lot of great tips to add in there on how to maintain a healthy lifestyle. Mm-hmm. As far as some of the topics we covered today, can you link?
Yes, I will link some resources in the description.
All right, we'll have a few things in there about nutrition and healthy eating tips, a couple of things on alcohol, moderation and who to call for what, and anything that you want to see about exercise. So Thanks. That was fun.
Yeah. Thank you. And stay tuned for the next podcast.